Hi, everybody. Welcome so much to our conversation today. My name is Alex Citron. My pronouns are she, hers, and I'm a senior associate here at the Center for the Study of Social Policy. I'm thrilled today to be joined by three amazing, thoughtful leaders, and we're excited to have all of you joining us virtually as part of this conversation. So today we're really going to be talking about what we owe young people who age out of the child welfare system, and how do we support and fund these resources in our communities? How do we make this a community-based, how do we build this community-based array of supports for young people as they've aged out? Before I pass it off to my colleagues to introduce themselves, I want to just take a moment to welcome those of you who are virtually to join us in conversation. You can add comments in the chat box, and we will be monitoring and bringing those in as we go. I want to also just acknowledge there's a little bit of feedback coming from my mic, so I will be taking myself off mute, putting myself on mute to try and mitigate that as much as possible, but want to just acknowledge that. As we engage in this conversation, I want to have folks just be a part of this, right? So I'm going to kick it over to these three amazing folks momentarily, and we're really just going to flow and have a great conversation here. And to kick us off with introductions, I'm going to pass it over to my colleague Leonard to introduce himself, and then you can pass it on to the next person.
Hey, thanks, Alex. Hello, everybody. Good afternoon or good morning, wherever you are at this point in time. I'm Leonard Burton. I'm a senior fellow at the Center for the Study of Social Policy. I use he, him pronouns. I work on our Youth Thrive initiative, focusing on healthy development and well-being of young people, as well as support our robust portfolio around racial justice and equity across the country at CSSP. I'm happy to be here with you and looking forward to the conversation. Thanks.
So let's kick it over to Elliot.
Hi all, my name is Elliot Hinkle. I use they, them pronouns. I am the principal and founder of Unicorn Solutions. You can learn more at unicornsolutions.org. I'm a person with lived experience in child welfare and mental health systems, and I do a lot of work with CSSP on their Youth Thrive initiative, both as a trainer and just a passionate advocate, knowing that Youth Thrive is really important for young people, regardless of system involvement. So happy to be here with everyone today. I'll give it over to Fallon.
Thank you, Elliot. My name is Fallon Speaker. I am a professor at the University of Richmond School of Law, where I also teach the Child and Family Law Clinic. My history in child welfare extends back my entire time after graduating from law school. I started off as working as a guardian ad litem in North Carolina, and then I moved to New York, where I started working at the Bronx Defenders. There I represented parents involved in the child welfare system who were accused of abuse and neglect, and that could be teens and that could also be adults. I have an extensive history working in coalition with communities and working on legislative policy at the city, state, and national level to reform the child welfare system. So I'm excited to be here today.
Awesome. Thank you all so much for those introductions. To kick off this conversation today, I want to start with what we all know, what we hear over and over again from young people, and what we see over and over again in the data. And that is that the child welfare system is failing. It's failing to provide the support to young people that was promised when they were removed from their families and from their communities. In our conversation today, we're going to explore both what young people need and how we can support them. And I want to bring in this concept of owing young people. We have this responsibility, right? We have removed young people from their families and their communities and promised something. And now we failed to do that. So what do we owe these young people as they age out of care? So just to kick us off broadly, I'd like to pose to the three of you, when we talk about what we owe young people who have aged out of care, what does this mean to you?
Well, I'll go first. I think for me, I think about my own experience in care just as much as the young people I've worked with. I think going into child welfare for me was a personal decision that I actually had sought out, knowing that the experience in my home was not good. And knowing that my peers were having a very different experience in their home lives. And I think I was met with a particularly great foster parent, but also knew that many of the aspects of the system I thought I would be receiving didn't necessarily happen. They weren't easy to access, they weren't clear, or there was lots and lots of expectations around what I needed to do to then be able to receive things rather than just freely receiving the care and services that I needed. I think for a lot of young people, if they don't know what they don't know, then they're not going to be able to get the services that they need. And child welfare can sometimes, intentionally or otherwise, make it really hard to know what is available for a young person to access, be it funding or services. So I think for me, I think we owe young people the experience that they're not getting if they're coming into care, but we also owe them connection to the people they want to be connected to have the life that they want to have. I think that young people might feel as if they come into care and what all the adults are telling them has to be true and they need to do those things, rather than getting to dictate and decide and drive the experience that they're having in care, even if that means getting out of care to be reunited with their families because they didn't come into care just to stay away from them forever. So those are some of my initial thoughts, but I'll give it to Leonard or Fallon if you want to chime in here too.
You want to go, Fallon, or
Sure.
I can go ahead?
Sure.
Yeah.
Yeah, I'll jump in. So I think there's a few different ways that we can think about what we owe them. I think first we have to think about what we owe to young people and to families, not to involve them in the child welfare system in the first place. It's a very oppressive system, and we know from experience of working in this system that systems cannot raise children, families can, communities can, and what we've done by placing them in the system is basically eradicate any support that they have had. So one, we have to think about the preventative methods that we can put into place to keep children at home with their families and within the communities that support them. But then two, I think we have to think about, well, now that we have these children in care, how can we support them? And one of the biggest things that comes up in the child welfare system is the lack of trust. It is a system built on not trusting families to take care of themselves, not providing them with the resources directly that they need to care for themselves. And so I think the second part of that is going to be, we owe these children resources. We've obliterated any opportunity for them to start to build generational wealth, and we've told them to go out into the world and to start to do that on their own. And so I think that we have to be we have to be ready to provide them with the financial resources that they need to do that. And that includes thinking about medical and mental health. It includes thinking about college. It includes thinking about their career. We know that children don't become grown just because they turn 18 years old. And oftentimes the children who are involved in the child welfare system who are aging out, and there is a many number that are aging out, but there are a lot who are also in broken adoptive homes. And are going back to the families who they have been disconnected from or terminated from. And so we need to think about how can we support them. And in my opinion, that means giving them the financial resources that they need to succeed. And then I think the third part is that we need to think about how do we rebuild the communities that we've already eradicated and the families and the support systems that they have. When these children are aging out, where do they go at? Who is it that they are going to be seeking out for support? We know that early on in the process, many of them have connections to family, they have connections to community, extended family members, and we should be actively building that connection and making sure that it's still in place so that when they leave the child welfare system, they have that community to fall back on.
Yeah, absolutely. And when we talk about leaving foster care, I want to put some numbers around what and who we're talking about. So in the United States, there are about approximately 424,000 young people in foster care nationwide. Atrocious. That 20,000 of those young people annually age out of foster care between the ages of 18 and 21. And then many of these young people ultimately leave care without a family support system, thus making them what we call circumstantially independent or lacking the social connections and concrete supports that guide young people into a thriving adulthood. And then within 4 years of aging out of foster care, 50% of these young people have no earnings, and those who do have earnings have an annual income of about $7,500. So we understand with these data that the system that people consider a safety and protection system has actually failed young people, failed families, and failed communities. So to Fallon's point, yeah, we owe them not to place them in an oppressive system in the first place. And I want to build off of what when we talk about what do we owe young people, I want to cite some things that Colleen Murphy, who's a law professor at the University of Illinois, states. She identifies 5 pillars of transitional justice, which are truth, justice, reparation, non-recurrence, and memorialization. In other words, we have to document and acknowledge the occurrence of human rights violations, the consequences of the victims, the responsibilities for them, and conditions that facilitated their occurrence is necessary. We have to tell the truth, and we can't hide the truth from what has happened to young people and what the system is doing to young people. And I'll say what we have done to young people, because I've spent time in the public child welfare system and in the formal juvenile justice system, juvenile policing system, and contributed to some of these. So acknowledging these occurrences is important. Then justice, the second pillar of justice, holding perpetrators to accountability, and that also contributes to institutional reform. In this case, I'm not really interested in reform. So I think that when it comes to child welfare, I call child welfare over the last 60 days the modern child welfare system, because it's not a new system, but it's a relatively new system. But this is the modern child welfare system. So over the last 50 or 60 years, what has this institution of child welfare, this system of child welfare, contributed to the failures and harms of children, families, and communities? We've actually extracted human capital from communities and left voids in those places, and then expected those places to thrive without the valuable human capital, the human resources that were birthed and born in those spaces and places. Then thirdly is reparations. The harms that victims experience at the hands of the state has a moral claim to repair. And then it's not just these apologies, but we're talking about money. Put your money where your mouth is. In fact, you've balanced the budgets on the backs of this population of young people. And so now let's change that. Let's flip that upside down and pay these people for what has happened to them. I think they deserved it. They earned it. And the resources are there. We've actually bailed out the savings and loan industry. We bailed out the car industry, the automobile industry. We bailed out other industries, but we don't help the families and people who are on the ground that are living these systems and being harmed by them on a daily basis. Fourth is the non-recurrence. It's essential to alter the underlying social and institutional conditions that explain how wrongdoing became widespread. It can't happen again. We have to stop it, and we have to make a commitment to the non-recurrence of these damages and harm. And then fifth, the memorialization. This is the fifth pillar of transitional justice, which requires communities to commit to remembering the past, including past atrocities, as a part of a broader effort to honor victims, understand wrongdoing, and prevent the recurrence of wrongdoing. So that, if we're talking about what we owe young people, we owe them transitional justice, we owe them money, we owe them truth, and we can't continue to hide this like some of these laws that we're seeing now that don't want to tell the truth and want people to believe that something else is happening in the world. I'll pause there and turn it back to you, Alex.
Thank you. And it looks like Fallon's jumping to get in here too. So, I do want to say, go ahead, Fallon.
Oh, sorry. I just wanted to say one thing is that all sounded like it was coming from a abolitionist framework when thinking about the child welfare system in general, right? And I think that, you mentioned the terms like reparation, but like and I mentioned this to Alex before, can we really give reparations to people who have been destroyed by this, families who have been destroyed by this system? There is no way to repair a family that has been terminated. You can't repair that. And so I think when we even think about this as like a financial, we can attempt to make these children whole financially, but we can never make them whole, right? Like we can never repair that. Yeah. And I think the other thing that we have to consider on the other end of this from an abolitionist perspective is the fact that continuing the child welfare system as it exists and the foster care system as it exists leads to what we call the child welfare to prison pipeline, but also it leads to what we call a recidivism pipeline in child welfare, right? The children who were once neglected and abused become the abusers and neglectors, because once they hit a certain age or they become a little older, now they're starting to be seen in the system as the same way as their parents, not as children who are in need of assistance, in need of help and guidance. And so they have these charges brought against them. And so as someone who represented a number of families, I saw that level of recidivism continue to happen. And once the recidivism starts, then all of the assistance that would go into helping a teenager who is 16 or 17 years old, who's trying to parent for the first time, it goes out the window, because now all we care about is now the newborn, the toddler, and we sort of throw this other child aside. So I thought it was a lot that you packed into that was really good.
Thanks.
Yeah.
And I appreciate the reframing of the reparation and the truth around you can't repair this damage that has been perpetrated against families and communities. So thank you, Fallon.
Yeah, I think for me, things that come up in relation to this conversation, though, too, are about young people. And I think it's a very American concept, right? Young people feeling like a lot of the things that have happened to them, it's also their responsibility now to have to figure it out on their own, that they have to go and get counseling as an adult. They have to figure out how to get out of debt. They have to figure out how to navigate their own children out of child welfare instead of child welfare taking accountability for the harms that it has caused and finding ways to either undo that. I think agree with Fallon of like, there's not a repair to happen there. More so an acknowledgement for sure of what has happened and then stopping that from happening ever again. I think about right now in the child welfare system too, the workforce turnover and the amount of people that are not in those jobs, to me raises the issue of if child welfare is in the business of supporting families as it is stated, have you bit off more than you can chew? So if you don't have the staff available to actually even do the job, are you also causing more harm by not being able to even meet the needs of those you have brought into the system? I like to raise that point because I think that there is a large amount of folks who are not going towards those jobs. So then you're bringing more people in than you can support anyways and creating an entire other issue. And I think the other thing I would say is that I think young people are treated in such a way that they don't know that they could ask for so many of these things and advocate to have these things, such as being paid, reparations, right? The conversations that we're having right now, I think young people aren't necessarily brought to the table early and often enough, and definitely not by the system, to say you should be asking and demanding for better than what you are receiving right now. And most of these things should not be happening to you. If we owe young people family and care, then why is it that that's not what they're receiving? So I think about that and how that was not conversations necessarily I was having in care, but if I had known more information, I might have pushed even harder to say, why is this the experience that I'm having right now?
Yeah, absolutely. I mean, I think for me, the thing that all of you all have touched on and shared is, this accountability and wanting this reparations, right? And wanting to provide these supports. We know that young people need the supports and the connections to their community. We know that we owe them, right? We owe them. We did this. We pulled them out. How do we do this without continuing to build this system, extending the system farther, right? We hear a lot about, the system will just support them longer and longer as they get older and older, right? The supports will come through the system. But as you all noted, right, there's a lack of trust with the system. The system has been balancing the budget on the backs of young people this entire time. We've destroyed communities. How do we rebuild communities? So, how do we take all of this reparations, all of the support that needs to be done, and do it in a way that rebuilds communities? We take it out of the child welfare system and give it back to communities to build and develop. Thoughts? How do we do this?
I know one thing that I've looked to that I think helped me think about what people think they're trying to do in social work and child welfare and what's actually happening is looking at mutual aid. So when I was reading one book by Dean Spade on mutual aid, they do a comparison of like what mutual aid aims to do, which is like providing resources to folks without any requirements of doing something to get that. Whereas social services is often, you need to do these 5 things and prove that you're this place for us to provide you the services that you should already have. So mutual aid in the sense of, how are we getting to a place where communities are supporting each other without holding up systems that aren't supportive, that are making people work harder than they have to get the things that they need? Additionally, I think a lot of funding goes into like nonprofits rather than directly to people who just need that money. And so what are we doing to say that communities should be getting the funding to decide for themselves how they want to support their community, rather than also funneling it sometimes through nonprofits who become just another gatekeeper to accessing funding and creating more stipulations for folks to even have access to do what they need or want with that. But Leonard, Bowen?
I was just going to say that, one of the things I think about when you mentioned this comment, Alex, is, and here in Virginia, this happened in New York as well, but here in Virginia, I was working with some colleagues on some legislation that would take money from the Family First Act, right, and provide that money to community-based organizations to provide those exact supports that we're talking about, right? So this would be programs that are already in marginalized communities. Maybe these programs aren't what you know, a lot of my social worker friends would say, you know, the terms that they be looking for. Is it what's the term? You know, is it something based? Is it evidence based, or, you know,
evidence
yeah,
based?
evidence based. Yeah.
I'm putting that evidence in quotes.
Right. Yeah, it has to be evidence based for it to be supported, for it to be something that we would support, right, or fund, or that sort of thing, right? But so these are, I'm not talking about those programs. I'm talking about programs that are in these communities that people trust, right? People trust these people because they grew up around them. These are their aunties. These are extended family members. These are people who are the village that we talk about, who should be raising children, right? And these are people that these children, families could go to get diapers. They could go to for daycare services. They could go to if they needed help writing a resume, if they needed help getting a job, if they needed assistance with housing, if they needed those sorts of things, because they feel comfortable doing that. They don't feel like they're going to be reported on. They don't feel like these are places of additional surveillance, right? They don't feel like these are systems, but these are actually supports. And we requested that money, and what we were told immediately was it's not evidence-based. It has to be connected to social services. It has to be this. And so until we can start to steer away from that belief that in order for money to be utilized by a community as a support system, it has to be funneled through DSS, we are going to be stuck. Because the people, DSS doesn't always know how to best serve the community, right? They're assistants. They're not there as a support, and in that way. And so I think one of the first steps is removing that layer, or that idea that in order for the funds to be accessed, it has to be through DSS or some evidence-based program.
I really appreciate your comments there, Fallon, particularly as it goes to Family First, because Family First was this groundbreaking, and it is groundbreaking in many ways, but it doesn't do what we're talking about. It is still for families that are connected and surveilled by the child welfare system. And the fact that they have to be evidence-based and rated by a specific clearinghouse really limits the programs that are available to serve families. It really puts a limit on services that are developed by communities to support communities. And families do have to be deemed eligible. That's what's in the federal law, right? So we've got to be rethinking completely how we identify and build new funding streams that don't do that, right? That don't require that attachment to child welfare. So how do we start thinking about a new funding stream that goes out and does what it's supposed to do, whether it goes through, you know, Elliot, I appreciate your points, right? Sometimes nonprofits can act as gatekeepers too, but how do we start to get money into the community, whether it's through a community-based organization, through a foundation, but how do we start to move money out in that way, creating a new funding stream, whether it's federal or state, that does not require those ties. It does not require the family to be on a prevention plan, does not require that that child is at imminent risk of entry into foster care. How do we start to fund and develop funding streams that way that really start to move more directly? So, and Leonard, sorry, I know you were trying to get in also. So
no, that's good. No, thank you, Alex. You sort of teed up several points I want to make. I'll try to be quick with them. First, we have to break this myth about what child welfare is to the general public, because the masses of the people think that child welfare and the child going into foster care is this wonderful place and magical thing that's going to happen to a child. And the fact of the matter is that we've just disrupted that child from every social support that they've had, whether it's their house of faith, whether it's their school, whether it's that mom and pop organization that that Fallon was just talking about in the community that people trust, people believe in, right? And so we talk about these nonprofits, funding nonprofits, and the question is, which nonprofits are being funded? And so you have the 500-pound legacy guerrilla organizations that everybody loves, that have hit the federal clearinghouse, that all the money continues to go through. They might be in the community, but they're not of the community. And what we need are programs and people who are of the community, who understand and can have the conversation that people trust and believe in. And so then the question for me also is, when we talk about this clearinghouse, we're actually looking who clears what gets in the house, right? So the gatekeepers, and then it's often this European dominant frame that decides what's evidence, what isn't evidence. And then those organizations, like one that I ran when I got out of the military in 1991, that would never reach an evidence-based status, but was valued by people in the community, by the schools, by mothers, by churches, etc., that would never get to the clearinghouse. And so if there is a value in this so-called evidence clearinghouse or evidence-based practice that people are pushing, then how do you help Miss Jones, who's doing the Jones homework at the Jones homework site in the backyard? How do you help her build the infrastructure? What are the investments in Miss Jones that help her build the infrastructure that then makes her so-called worthy of these public dollars? And then that's the debate. Who's worthy of public dollars and who isn't? So I live in Rocket City, where we have a lot of defense contractors, and I watch things fly across the airways. People talking about how much they hate government. And I remind people in my own way of these government contractors, you on federal assistance yourself. You collecting a check from the federal government every day, but somehow you and your industry is worthy of those federal public dollars when Black and brown and poor people are not worthy of those dollars. So we have to demystify what child welfare is and really tell the truth about what it is, going back to those 5 pillars of transitional justice. We have to tell the truth about what it is and not be afraid. And then we have to repair those harms that's happening.
Yeah, I think something you raised, Leonard, and I think sometimes it just gets overcomplicated far more than it needs to. And maybe it was Alex actually, but how do we get funding to people? So we just did it in the pandemic, right? There was a really easy way that somehow the government was like, here you go, here's money in your bank account. I don't really need you to prove much. Here you go. Similarly, with the PPP loans, they've already forgiven like 6 million or 6 billion. I forget the number, but much of that has already been forgiven, right? And so the ability to do so gets overcomplicated, I think, largely because authority and structure and systems say we need to have lots and lots of hoops to jump through to prove that you are deserving of this. But then at the same time, we'll say, here's this money really easily, no questions asked, to see you later, And so I think that the idea of we need to figure out systems and structures in place to get money to people feels frustrating because it feels like a delay in just doing the work and just making it happen. And kind of saying we need to just trust communities to do that rather than this fear of what's going to happen. They're going to do something differently because that's what they need to do, but trying to decide it for them just isn't working. And so that has stuck with me since those not stipends, since those happened, whatever it's even called, the stimuluses, that it's so simple that we already know how to do it.
Elliot, I love that. I love that you brought up that example, because we talk about what I've been hearing here. You all talk about is right. We need infrastructure. We need public dollars. Needs to be community based and needs to be outside of child welfare. Right. That's how we set up the ability to support young people who have aged out of care. Right. That's how we've. And the thing is, we know what we need. And we've done it, right? There were community-based organizations that were helping people get signed up for those stimulus checks, right? That infrastructure, we provided supports to communities so they could do that. And it makes me think of, one thing we often hear people say is, well, this sounds great, but it's not how things work in my state. It's not how things work in my jurisdiction. It's not how things are set up to do now. So what do you all say to people who say that, right? How do you start to push this conversation around what we know and what we owe young people who've aged out of foster care?
Go ahead, Dr. Fallon.
I think it's two things, right? One is that we have to organize and we have to lobby at the legislature for a basic living wage. And that is a preventative measure for families in general. That is something that can help prevent people from being involved in the child welfare system. Absolutely. We know that 95 or so, maybe a little less % of cases are actually neglect cases, of which people don't have adequate housing, clothing, food, and shelter. So if we can prevent 90 something % of those cases from even coming into the system, right? We've already beat a hard part of this problem. And the second part of the equation is then what do we do for the families who are involved, right? You know, how can we service them? You know how many families I work with where if I tried right now, if someone came into my office right now and needed assistance with getting mental health, you know how many months they would have to wait before they could get treatment? You know how many, if someone came in right now and they used a substance, if they had a child and they wanted to be placed with their child into a home, you know how long it would take them to get placed into some sort of supportive housing? Over a year, 2-3 years. If they had a mental illness, if they needed some sort of facility where they could be with their child and, you know, get the supportive services that they needed, that's a 2-3 year wait, or it just doesn't exist, right? And so when we talk about what happens now that they're involved in the system, it's okay, what services do we need? We don't need more parenting classes.
Right.
A lot of funding goes into providing parenting classes. A lot of funding goes into sort of providing these surveillance mechanisms. But what people need is access to food, clothing, shelter, insurance, healthcare, mental health care, to be able to get a job. Once they get involved in the system, then the burden becomes, oh, I don't have a place to live, to be able to get a place to live. Oh, I don't have a place to work, to be able to get a place to work, and then to be able to further their career. And that is the part where we start to build wealth, and that brings the family from a place of being on a path to recidivism to a place of changing the outlook for their family in the future, right? And that helps children. And so I think that once, you know, yes, we need a basic living and minimum wage for families, but once families are involved in the system, what we need to talk about is paying children directly so that they can start to build themselves out of a system of recidivism that is sure to happen if they are raised by the child welfare system, because they are not going to be provided these things long term that they're going to need to sustain themselves.
So we've done that. Go ahead, Leonard.
Well, I was going to say that goes to this idea. Alex and I have been having this conversation for a couple of years now around making young people who age out of foster care categorically eligible for a guaranteed income, because that part right there is part and parcel of the reparation that I'm talking about, Fallon. They should be categorically eligible because we've disrupted their lives, and they should have those resources. And there are some pilot programs out there now, you know, that are testing, you know, guaranteed cash transfer, guaranteed income cash transfer projects right now. $1,000 a month. I don't know what the number is, right? But we have enough behavioral economists, people who so-called smart and experts, who can figure it out. But we definitely need to pay these young people who we pulled them out of their families, disrupted their growth, their developmental arc. We've disrupted their community settings, and then we've arrested their development by holding them in congregate care settings, in some foster homes, even that did not allow them to grow and mature and get nurtured in the way that every young person should have the fundamental right to be.
And I think beyond that, or in addition to that, Leonard, right? We have policy that youth who have aged out of foster care are categorically eligible for Medicaid, for health insurance, right? If they don't meet the income requirements, no matter what, they get Medicaid. Why don't we think more broadly around extending that, right? Why aren't they categorically eligible for SNAP, food access, right? We have these housing programs, the FUT vouchers, the FYI program, but all of these are limited, right? And even if you have a voucher, how hard is it then to find a place to live? I remember from my direct practice days, I know that I'm looking at all of you all here. This is not news, right? How difficult is it to find a home that is safe, in a safe neighborhood, in a neighborhood where it's close to your family, your work, your school, that works for you? It's difficult. So we've got to tackle this from both issues, from both sides of the coin. But all of this, as I'm hearing you all talk about it, is outside of child welfare, right? It's all about outside of child welfare. How do we get child welfare to recognize that and contribute in the ways, but not hold on to that? That is not part of their system, right?
Absolutely.
I mean, part of me feels like child welfare already recognizes it. You know, some of the things that we talk about that the states that have some of these programs in place for children. I know there are some states that pay for college, but the child is still in foster care. They will pay for college for that child, or they allow them to stay in foster care until they're 21 years old or something to that effect. But those states also have policies or little contingencies, right? You can stay in foster working if you meet these guidelines, right? They have these contingencies that say, like, if you don't do everything that we tell you to do, and they use it under the guise of we're trying to make this person aware and able to be out in the world, but that's not really it, because what 17-year-old is being told by their parent, if you're not working, you can't stay in my house at 17, right? Like, that's not the situation. And so I think that those sort of contingencies, I think the foster care system knows that. I think the child welfare system knows that, right? They place these contingencies on children, and they tell them, if you want our help, you have to do what we say. And they're coming at them from a system perspective, and not from a perspective of, we want to help you be a person who's able to thrive in the world. How can we help you, right?
And I think that's what we've got to
offer
shift,
it to
right?
them from that perspective.
Yeah, I think that there's a lot of that, like the conversation, Leonard, you were bringing up around the funding or behavioral economics, who can figure it out, right? I think that the reality is there's a ton of money in child welfare right now, and a lot of the money is going towards funding staff, right? So my thought is, if we're trying to help people and we're trying to prevent harm, I would like to think that we should be working ourselves out of a job, right? If we are truly helping people, then our need to be there should decrease over time. And so the amount of funding that goes into having positions, many that are not filled right now, in budgets that can be money that could go directly to families and communities, is not something that's necessarily discussed. And I think we don't always talk about it as, am I working myself out of a job, or am I continuing a system that will continue to keep me fed and housed while harming other folks? And I think it makes people really uncomfortable, because they're like, I want to do social justice work. I want to help other people. I would like to dream of a world where I can help other people without it being dependent on them being harmed. Maybe I can help them learn how to garden and grow food, right? Something weird and crazy, a job that I enjoy that doesn't involve stress and is still helping people. But I don't think that we can get there until folks are willing to understand that, like, if we're going to actually help families, then we have to figure out when we get out of the way and let them do the things that they need to do, and stop taking that money as our income.
Yes.
But Elliot, I think that goes to Alex's point too. Sorry, Leonard. I was just going to say,
no, go for it.
The system never is going to want to work itself out of a job, right? Because if that were the case, we wouldn't wait until people were in foster care to say, oh, we should give you a stipend. We should be able to, we would say that just by way of becoming involved in the child welfare system, you should be eligible for certain things. If we did that, it would bankrupt the child welfare system. Right. If we said that just by way of becoming involved in the system, you're eligible now for us to provide you with these things, it would bankrupt the system.
Right. Yeah. And it creates this perverse incentive, right?
That's right. Yes. I mean, what we're talking about is the commodification of Black and brown bodies. Let's be clear. People are making tens of millions of dollars off the backs of Black and brown kids and poor kids in this country by upholding and maintaining this oppressive system that we call child welfare. And which we should really be called family policing. We should be calling it family regulation, anything but child welfare or child well-being, because it's not helping the welfare and the well-being of children and families.
Absolutely. And when I was thinking of mutual aid earlier, this book kind of does a comparison of mutual aid versus charity. And I think charity being the way that, like, social workers might think that they're going about the work. So in mutual aid, people would use people power to resist any efforts by government to regulate or shut down activities, where in charity, you follow government regulations about how the work needs to happen, usually requiring more money, causing reliance on grants and paid staff with professional degrees. Additionally, in mutual aid, you give things away without expectations. In charity, you set conditions for getting help. Recipients have to fill out onerous paperwork, be sober, have a certain family status, have a certain immigration status, not have outstanding warrants, etc. And so I think about how it is not that hard to get to communities and let them dictate what needs to happen, because it also takes a lot of the work that people are doing that also, I don't know that most people enjoy doing the work of standing up the system all the time. The administrative duties that come with that, like, that doesn't need to happen. So we can actually just, again, get back to the human aspect of helping people and letting them determine what that help even needs to be in the first place.
So we're getting a lot of comments in the chat. Folks are stoked about this. Folks are agreeing with you all. As anybody who's ever worked with Leonard knows, people are saying, preach Leonard. It's what we'd say all the time. Leonard, you just talk. But now we've got people amped up in the chat. We're all clearly amped up here in this conversation.
Mm-hmm.
What do we do? How can we change this? What's the approach? Is there a legislative approach that we take? How do we move forward? We have the word fund in the title of this conversation. How do we fund this? How do we move this forward?
So I would suggest we start. I think it's a convergence model. You start you start at the grassroots, at the local level, and at the federal level simultaneously. Because there are things at the local level that can be done, and so we have to mobilize, we have to organize and advocate at the local level for those things that we see would help bring about a beloved community. And what does that look like? What does that look like for me? How do I contribute to that? How does my neighbor contribute to it? And how does everybody around me, every structure, every institution around me contribute to operate from this idea of how do we create a beloved community so that there are no situations in our society that creates the stressors to the point where a person feels that they need to and then abuse a child. Right? But I want to be clear to Fallon's point, 80 to 90% of the cases in child welfare are not abuse cases. So why are we bringing kids into care around social issues that can be solved at every level of government in our country? And so I say we mobilize at every level, and we create these ideas of what it takes, and we test them out. We do some rapid do a rapid testing cycle. We do some PDSAs, plan, do, study, and act. We take that to the local level. We take some of these methodologies that we have in these think tanks and academies, and we apply them at the local level, and then we begin to change step by step, person by person, block by block, neighborhood by neighborhood, to create the community that we, as Elliot talked about, visioning exercise we need to do, and it needs to be real.
I think we also would have to be willing to not be the experts at all times. I think being open and honest with the fact that we don't have all the answers. So we either have to collaborate and figure it out together, or understand that I don't need to be the expert of all things, but I need to find out who that person is and get out of the way. Because I think a lot of times there's the best of intentions, which the impact of that is still harm. And I think about how often folks want to support the needs of LGBTQ young people in child welfare, right? But they don't even know where to start, so they attempt it, and it just makes it worse. So if we know we're not the expert in that, then why don't we actually talk to the experts in that and let them do the work? And particularly young people and people with lived experience are also experts. They know themselves best, and they know their experience is best. So they can actually hold the answers for us without us having to do so much work to try and figure it out. But sometimes we make it harder for ourselves when we don't just start there and ask people, what do you need? What do you know? What's not working? How can we make sure that doesn't ever happen again?
I would agree with both of those perspectives, and I would just add that we have to start at the community level and think about what is already present and how can we support this. I think in the child welfare field, there's always this need or idea that we have to reinvent something or create something new. But there are so many community-based organizations, religious organizations that are already in place and doing the exact work that we're talking about right now, that we can put our support behind and help to uplift, right? So I think that we can start there. I think we can think about the expertise that we do have. And Elliot, thank you so much for raising this, because it's going to really require a holistic and interdisciplinary approach to resolving this, right? We can each take the different levels of expertise that we have and put that behind and support and amplify organizations, community members who don't have that level of expertise. You build those organizations up, and then they become the powerhouse and the leaders of this movement, because they are the people with the lived experiences. They are the people who are being traumatized and surveilled by the child welfare system. They are the people who are having their children removed. They are the children who are in foster care, right? And once they are amplified, their voices are amplified, and they have that support, then they can, with our support, go into the legislatures, and they can start asking for different legislation that's needed. When I was in New York and part of the work, and work with a lot of leading parent advocates there, many who have experiences as through recidivism in the child welfare system, but a lot of those people were able to lead this movement in a way to actually create legislative change. It didn't happen overnight, and it happened within a year.
Right.
It didn't happen within 2 years, but it happened over time. And now they are the voices, right? They are at these tables, at the same tables that DSS is at. People, the governor wants to listen to those people. The legislators wants to listen to them. The mayor's office, city council, everyone wants to listen to these people with lived experiences. And so I think that us, the experts, have to be willing to come down and talk with the people and put our support and our voice behind the people. Yeah. And I think that I agree. Attacking it both at the community level as well as at the federal level is going to make a big difference.
And I just want to underscore too the consistent kind of, it has to be consistent and ongoing. I think of Martin Luther King, right? Mm-hmm. The work that he and the coalition that he built and the teamwork that happened there was not just every so often, right? They knew what they needed to work on, and they continued to do it together, ongoing, continuously, speaking truth to power, not trying to tiptoe around it. And so I think that has to happen, where people are coming together on a solidified or unified kind of message and idea, and people are continuing to hold that up and challenge power, rather than, well, we tried, here's an initiative, the initiative's over, moving back to things as they used to be.
Right.
Yeah. No, I really appreciate everything.
There was a question in the comment.
Yeah, hold on. I'm just going to hop in here, and then we're going to get to that comment. So I just want to build off of what folks were saying here, right? That we got to recognize when we're not the expert. I say I work in child welfare. Child welfare often thinks we are the expert. We got to solve those problems, right? We have to be the ones who are leading and solving the problems. No, we're not always the ones who have to solve the problems, right? We have to support and really recognize when it's not, this should not be the system, the child welfare system, trying to build something new. Child welfare should not be trying to build something new in the community. We've got the community to do that. I want to also highlight a couple of things from this multi-pronged approach. You all talked a lot about the community. There are lots of opportunities now in legislative agendas to move from that perspective too, right? We have the child tax credit moving towards a child allowance, paid leave, right? Child care, and also thinking about all of these funding streams without requirements, right? Removing work requirements, for example, right? These are things that keep families tied to systems. And again, who's worthy, who's not worthy. So I want to just highlight those things in the multi-pronged approach. We also have Title 4B reauthorization coming up. There are opportunities within Title 4B. That money does not have to tie and sit to families who are attached to child welfare, right? It can go out into communities. So how can we use this opportunity now, both at the federal level, and then when the money gets given to the states, to get it into community, right? What is our role here, and how can we do that moving forward? I would challenge folks to think about what your role is and how you can do that. There are a couple of questions in the comment box that I just want to bring in as we wrap up. Somebody asked, this isn't happening in my community. How do I reach out and help in other communities? How do I get involved in other communities? And I know Fallon has responded, has a response here. So let me kick it to Fallon first.
Yes. So there are, I think, to that specific question of how can I get involved if I don't believe that it exists here in my locality. There is a lot of national organizations. I'm happy to share with Alex a list that I've been putting together of resources of national groups of people who are organizing around these issues, from social workers to parent advocates to people with lived experience in the child welfare system, either as children or as adults. to people who are attorneys and who have represented guardian ad litems, all different sorts of people, even DSS workers and social workers. So I think there are a lot of people who are starting to organize around these issues. The reason why national organization is so helpful is because you're able to see the strategies and how they're implemented in different localities and different states. And we're seeing where there's an issue, we're able to sort of tweak that issue and then do it again. And if with continued ability to be able to keep doing it, as Elliot mentioned, right? Continually and attacking these issues, we're starting to see some growth and some change. And all it takes is one state. All it takes is one state to make a change. And then every other state can say, well, this state did it. Now you should follow this lead, and we can take their lead. And then, once they have the data, once New York was able to show the data that it helped to have representation before someone, became involved in child welfare, it helped reduce cases by this percentage. Now we're able to go to other states and say you should fund parent representation, or you should fund representation prior to a family coming to court. Once we're able to start to create the data, then we have a track record to take. And so I think that even if you don't feel that you can get involved at your local level, you can absolutely get involved in some aspect at a national level. And I'm happy to help to try to connect you with organizers and people who are doing this work nationally.
Awesome. Thank you. So we've got just a couple more minutes today in our conversation. And, I am not the expert on this. I am so thankful to have the three of you join and be a part of this, right? Bringing the experts to the table. And want to just ask you all one last question. As folks leave today's conversation, what's one thing you want folks to walk away with today as they leave our conversation? Or two things, because I'm always bad at picking just one thing too.
Something that is really important to me that relates to this conversation, but also just relates to young people in general, is that loving and affirming LGBTQ young people is a form of suicide prevention. And all it takes is one supportive adult in a young person's life to change the trajectory of them wanting to stick around or feeling like they can't. So I would just ask, if you are a person who is around young people and you're not already doing that, please do that, because it can change lives and keep people around, especially in a system that doesn't have the capacity to fully and quality serve young people. Youth of color who are LGBTQ in particular are most at risk of ending their lives and not having the supports that they need. So regardless of the system being able to provide it, please, if you're able to, step up and connect young people to those supports and care, because they need it. And I want those young people to stick around for their whole lives and be here with us. Leonard or Fallon?
I'm deferring to Fallon.
Okay. All right. So this is sort of a last thought here, Alex.
Yeah.
I guess my last thought would be that I think that, we talked about some really I feel like the conversation has felt very weighed down, as in like almost hopeless. Like, like we're underneath this system that, we really can't see the light at the end of the tunnel. But I would just say that I can see the light, and that's just with working in this system for the past 7 or 8 years. We have made so much headway, and the outlook on what people's perspective of the child welfare system and its placement and juxtaposition to working with families and being able to help families, that has changed tremendously, right? People are starting to think about how racism plays a part in this. People are starting to think about the detrimental effects in terms of recidivism, in terms of the child welfare to prison pipeline, in terms of the harsh realities and outcomes for children aging out of foster care and those being displaced while in foster care, right? We are starting to bring these conversations to the forefront now. And that is something that has not always been happening. So I would say that even though it may look a little grave right now, that when you get in community with people who are thinking about these issues and working to push sometimes reform, but largely abolition of this system to improve the lives of the people who are most harmed by it, then I think that will give you some renewed energy and ability to be able to continue to fight this good fight. So I will offer that.
And thanks, Fallon. And I'll offer and challenge people to take the my child and my family approach to anything that you want to do in community with people. If you're a social worker, a case manager, whatever the title it is that you carry, if you're, just a general, a person, a part of the body politic, the general body politic in this country, use the My Child test. What would you want for your child? What would you want for your mom? What would you want for your dad? What would you want for your family? And use that to ground yourself in how you would find, what would you do to go to some of us would go to the ends of the earth to find the right resource that was needed to hold our family intact. And the challenge that we face is when we start searching the ends of the earth, that we run into people, we run into systems, we run into these barriers that don't allow us to continue doing the work that we do. So my challenge to you is, don't grow weary in well doing. You're gonna reap if you faint not. Keep pushing, be resilient. And I was listening yesterday. I was in a meeting yesterday, and someone said, we were doing a training yesterday, and they were talking about resilience. And this person said they read the article in the New York Times about the Bronx fire. And one quote from someone said that people say we're resilient. They say we're not resilient. We are resisting death. And this isn't about, so in our resilience, in the Youth Thrive, we have 5 protective promotive factors: youth resilience, social connections, cognitive and social emotional competence, knowledge of adolescent development, and concrete supports in times of need. We have to help build these protective and promotive factors with young people and also with parents. And if people understand the value of these protective and promotive factors, then we can really see what our community, we can really see a community that is beloved, that is healthy, that is strong, so that no family has to go into a public intervening system like child welfare or juvenile justice.
Mm-hmm. Sorry, I just wanted to add one thing. I think there was a comment earlier about what do you do if it feels like there is no organizer or a group that's doing this work here. And I think that one of the things that you can do is you as an individual, as a person, can start to make a change, right? So for example, if you know that, youth who are aging out of care have a hard time with finding a career, you can work with maybe some recruiters or in that area to put together programs that would be a funnel or create a pipeline for children who are aging out of foster care, who are in foster care. You could, reach out to hospitals and local doctors' offices and try to put into place pro bono programs that would allow for those children to be able to receive certain levels of care there. It doesn't need a legislative or expert. You don't have to be an expert to sort of start being the change that you want to see. And so at a very micro level, you can be the first piece of change. And that just involves you deciding that this needs to happen and figuring out who I need to talk to start trying to create these changes. I will guarantee you that, colleges, recruiter offices, different employees, they want to be a part of the change. They don't know how bad the system is always. And so a lot of times they need some education around that, but you can definitely start doing that work yourself.
Yes, and I think the final thought I'll add is related to hope. The young people are like my favorite to work with because there's so much energy and passion and promise in them. So if you're ever needing a refresher on hope too, I would say connect with young people and let them tell you about what they want to see done and how they want to do it, because the energy behind young people around today is phenomenal and impressive. And it gives me a lot of hope that they have a lot of power in them when we give them the space to do so, to really change how we see the world right now. So just really look to young people because they are powerful. They are resisting death just as much as they are resilient. And I'm proud to get to work with them every single day.
Wow. I hate to have to follow the three of you with your closing thoughts. I love that we started off this conversation, though, thinking about young people and what we owe them. And we're coming back to young people at the end, right? Around how resilient they are and how they give us hope. So, through this conversation, I've learned a lot. I've enjoyed being a part of it. thinking about transitional justice, reparations, really getting back into the community and learning from the community, letting the community lead. We know that this has to look different, and we know that it has looked different in other industries, right? There are other industries, other spaces where this has been figured out and where we have deemed folks worthy. So why not us? Why not young people who have aged out of child welfare? And I appreciate the comments that were made today also, that while we started this conversation talking about young people who have aged out of child welfare, this is about families and this is about communities. Young people exist within families and within communities, and we've got to start recognizing and affirming that from the front end, not preventing, but supporting families in communities, right? And supporting young people. So I want to just really thank you all, myself, CSSP, everybody who's joined the conversation today. Really want to thank the three of you for sharing your expertise and being in conversation today. Please look out for the Youth Thrive policy agenda. Connect with our three amazing speakers online through their Twitter, their Facebook, Unicorn Solutions, University of Richmond School of Law, Leonard at CSSP, and the Youth Thrive work. Again, thank you all for being here. I feel so honored to have been in this conversation with you all.
Thanks, Alex.
Thanks, Alex. Thanks all.
Thanks, everybody.
Bye, everybody.
Bye.